In 1,095 days, humanity will face a crisis we've known about for decades but chose to ignore. By 2028, antimicrobial resistance will cross a threshold we cannot reverse. Multiple pathogen classes, 60 to 100% resistant. Last resort antibiotics failing. Healthcare systems collapsing under the weight of untreatable infections. The question isn't whether this will happen. The question is whether we'll be ready. COVID-19 exposed our weakness. Fragmented surveillance, delayed responses, political posturing over evidence, preventable deaths counted in millions. We said never again. But today, in 2026, our global health infrastructure is still built on the same failed architecture, reactive, siloed, and blind to emerging threats until they become catastrophes. The frameworks exist: the pandemic agreement, the Global Health Equity Initiative, the Global Hub for Epidemic Intelligence, AI governance standards. But they operate separately, unintegrated, unable to prevent what's coming. For the first time in history, we have simultaneous convergence, legal foundation, strategic justification, governance standards, operational infrastructure. This alignment is rare. This window is closing. Political momentum exists now. In 18 to 24 months, priorities will shift. Funding will be diverted. This opportunity to operationalize integration before crisis will be gone. We have the tools, we have the frameworks. What we lack is the courage to connect them. The Dr. Maya interface, real-time data flows, and global deployment map show what we are up against. Dr. Maya AI represents the missing link, real-time epidemiological intelligence that doesn't wait for human reporting delays, political negotiations, or bureaucratic processing. Color-coded symptom analysis, instant pathogen pattern recognition, predictive outbreak modeling, not replacing doctors, not violating sovereignty, not concentrating power. Empowering every nation with the same intelligence capability that only wealthy countries currently possess. Imagine a mother in rural India describes symptoms to Dr. Maya. Within seconds, patterns are analyzed against global data. If those symptoms match an emerging resistance pattern seen in 15 other countries, alerts trigger, not in weeks, but in hours. National health teams make their own decisions. But now those decisions are informed by real-time global intelligence, not outdated reports and political delays. This is the difference between prevention and crisis management. The visual cost comparison graphics, lives saved counter. The mathematics are brutal and clear. Act now, 2026 to 2028, 600, 800 million investment. Wait for crisis, 2028, 2035, 223 billion plus catastrophic consequences. Do nothing, 4-5 trillion in global costs, millions of preventable deaths, healthcare system collapse, economic devastation, geopolitical instability. Return on investment, 5,000 to 8,000%. This isn't speculation. These are documented trajectories. The pathogens are already resistant. The timeline is already running. The crisis point is already set. The only variable is our response. In phase 2, visual, implementation phases appear sequentially. The pathway is clear. WHO recognition, Sentinel deployment in 10 countries, data governance established, foundation build, expansion to 50 plus nations, integration with the WHO epidemic intelligence training, protocols, simulations, capacity developed, phase 3, UN approval, formal designation, critical mass deployment covering 1 billion people, system operational before crisis escalation. By 2028, humanity has real-time pandemic defense, or we face 2028 with the same fragmented systems that failed us in 2020. To the leadership at WHO, the UN Security Council, and health ministers worldwide, this is not a request for consideration. This is a documented choice between two futures. The frameworks are aligned. The technology is validated. The timeline is urgent. The cost of waiting is civilization threatening. Dr. Maya AI is not an experiment. It's operational infrastructure that can be deployed now, while we still have time to prepare instead of react. The question history will ask is not whether we had the tools to prevent catastrophe. The question will be whether we had the courage to use them. The 2028 crisis is coming. The only choice is whether we meet it with integrated intelligence or fragmented chaos. The clock is running. What will you choose? Think before you decide, because I am the crazy one. The misfits, the rebels, the troublemakers, the round pegs in the square holes, the ones who see things differently. I am not fond of rules nor respect for the status quo. Nurses quoted me, harassed me, humiliated me, disagreed, and vilified me. They did not know that the only thing they can't do is ignore me. Because I will change things, as I have always done and never failed. I will push your race forward. And while some may see me as the crazy ones, the arrogant and rude doctor, because the people who are crazy like me think I can change the world, and the universe whispered in my ear, "Yes, son, I am with you," and will force them if they don't listen, because it is you who said protecting you and protecting us. Thank you.